If you are watching this morning having some problems with your back, you are in luck because this is Chip Clifton. He is with the Center for Sports Medicine, and he is a physical therapist specializing in spine therapy. Good to see you.
It's good to see you.
I think I'm going to say, where have you been all my life? Because I had a back injury, Chip, when I was in high school, a pretty bad one. And so I still, to this day, if I stand for long periods of time, will get real problems in my lower back. You specialize in people like me.
Yes, I specialize in treating people like you, and let me say, I'm sorry that happened. That's very difficult to deal with, but you're not alone. Research and studies show that 4 out of 5 people will experience some type of low back pain in their lifetime. And I think if we looked at everyone in the room, probably 1 of 3 in the room right now are experiencing low back pain.
I think if you live in these days, you're going to have some type of back pain, whether it's low back pain or neck and shoulder pain, because if you're on your phone a lot, if you're sitting a lot, which most of us do now, that leads to problems, right?
This is very true. We find that anytime you are in one position for a prolonged period of time, it does increase the likelihood of you having pain. But I have to say, back pain is not normal. It's common, but it's not normal. So I would want you and anyone watching today to know that back pain is not something you should feel like you have to live with.
Okay, a few things to point out. You are kind of pretty much stationary in the Hixson location,
That
right?
is correct.
That's where folks will find you.
Yes.
Also, unlike a lot of things in medicine, when it comes to physical therapy, you are what they call direct access.
This is
the patient
correct.
can just make their own appointment.
Yes. What we find with direct access is that patients can seek us out. So if you're having low back pain and you woke up today and your back is hurting, you could actually call the office and schedule an appointment with me or one of our other physical therapists. We have locations all throughout the Chattanooga area.
Okay.
And we have members of our spine team who could actually see you and help you with your spine pain.
The other thing I think I know is that this is something that you don't want to put off, because most of us on our insurance plans have a certain number of visits we get.
Yes.
So the sooner you come, the more results you're going to get for that dollar.
That is a wonderful subject to touch on. The earlier you have access to physical therapy, it decreases the likelihood of you needing anything beyond therapy significantly. You're likely to avoid needing a shot, highly unlikely to need surgery, and the number of visits and the cost to you is significantly less the sooner you seek out physical therapy.
Okay, so now I'm going to go and hit myself on the hand for mentioning my own back pain, because mine is negligible. I can kind of control to a large degree when it surfaces and when it doesn't. But there are people watching who are dealing with really chronic back pain,
Yes.
and they're afraid of needing a surgery. So in those situations, they too can come to you.
Absolutely. And if someone who is in chronic pain or acute pain calls our office, they are going to call someone in our call center, and they're going to go through a series of questions to help figure out how to direct that patient's care.
Okay.
So if someone calls our office and they've already done physical therapy, they're most likely going to see someone else on our spine team, a mid-level provider, or even one of our surgeons, or a non-operative physician. However, if someone has never had physical therapy and they're a good candidate for therapy, our call center will ask if you'd be interested in trying therapy.
I would imagine that trust relationship between you and the surgeons is really important, because often, I guess, a patient comes to you in the hope that physical therapy will be sufficient. If it's not, then the orthopedic surgeon needs to really hear your take on it.
We have trust. We have trust between the provider and the patient, and then our providers on the team. So that trust and that continuity of care allows us to direct the patient's care, because the last thing I want to do is send the patient somewhere and get an unnecessary surgery. But I can have confidence in our team that if I am not having success in therapy, I can refer them or send them on to one of our other providers to get the care they need.
I mean, let's take like just your weekend warrior, right? Your pickleball player, you're out raking leaves in the yard, you go the wrong way, something that's not exactly horrifying, but you've hurt yourself. Can people like that come to you too?
Absolutely. And those are most likely the people that would benefit from direct access the most. Something relatively new and something that could be very easily fixed or remedied with just a couple of visits of physical therapy.
If you are exercising as part of your daily routine, but you're not cross-training, like I'm a walker.
Okay.
And I think as I get older, I can feel myself getting stiffer. It's harder and harder to be flexible, and probably I don't exercise my whole body enough. Does that happen?
That very commonly that happens, and I encounter a lot of patients when I ask about their exercise history that they walk, and that is a fantastic form of exercise, but I would encourage just a well-rounded exercise program, stretching, mobility training, and some strength training a couple of days a week.
Once people come to you and they get those PT exercises, which they will do at home too,
Yes.
is it a good idea to continue doing them for a lifetime?
Not necessarily. I would say continue the exercises for 6 to 12 weeks,
Okay.
a month and a half to 3 months. But then I would encourage people to just resume normal activities, become more active, and just live their life.
Well, here is where you can find him. It's part of Center for Sports Medicine. So Chip is going to be at their office in Hixson. You can call the Macaulay Avenue location if you want to, though. 624-2696 is the phone number there. You can ask for that PT appointment. And he got a late start to his day this morning because typically he's seeing patients as early as 7 o'clock. So if you're an early riser, he can help you. Great to see you.
Thank you.